We get this question all the time when patients come in for consultations, and it's a great question. How long do implants last? Many factors go into this. You can't go into an office and if they're telling you the implant's going to definitely last forever, run the other way. There's lots of different factors, starting with the type of implant that's placed. Do you want a well-proven implant brand of longevity and research to be placed in your mouth? Second, it's who places it and the method they use. Implants should all be guided, in my opinion, using computer simulations before the patient even comes in, so the surgery's done ahead of time. We know that if we guide it, it's going to be placed in the exact correct position with enough bone around it. If it's not placed in the correct position or there's not enough bone around it, which can also still look okay on an x-ray, then the implant could fail or not last as long as it should. If the patient's a healthy patient and you care for it just like your natural teeth and you floss and you brush and you go for regular checkups, they can virtually last forever. You have to remember that they can't decay. The only thing that's going to affect an implant really is either bone loss around it, periodontal disease around it, which means the drawing back of the bone, an infection around it caused by usually periodontal disease, which is an infection of the gums first that moves into the jaw. And that's pretty much it. They can't decay, or trauma. Actually getting trauma can damage them. That's why we like to use an implant that's well known, been around for a while, that we know that their materials are strong. And virtually an implant can last forever if it's cared for properly. Everyone still has to go for their natural cleanings, their normal cleanings. Pretty much could last forever, but without proper care and without careful placement, such as guided computer placement, which is what we do here, there can be issues. So, got to do your homework.